I know how frustrating it can be to study all weekend long and not do well on your exams. I also know what it feels like to enter a nursing program as a 3.5, 4.0 student and suddenly be a C student in nursing school. Well, in this video, I'm gonna break down everything you need to know to ace your nursing exams by how to prepare and breaking down the questions to see what exactly they're actually asking you. If something like this interests you, stick around and we're gonna go through all the tips to pass your nursing exams. You guys, nursing exams are extremely difficult and they're not like any other test you've ever taken before. So you need to understand how the questions are structured and how to break them down in order to answer correctly. If you're new to my channel, my name is Jamie. I'm a registered nurse, but I'm also a nursing professor. And I do tests on my students all the time, every week, and I see the same mistakes. Once my students learn how to break down the questions and look for keywords, they do so much better. So I decided to make a video so they could watch it before their first quiz and hopefully avoid that first crushing nursing quiz. First things first, in nursing school, we develop quiz questions based on Bloom's taxonomy, which is a pyramid of different levels of understanding. So in the first semester, we focus on remembering, understanding, and applying. So when you're looking at this, remembering is the most basic type of quiz question and probably what you're used to in other types of classes that you've taken. So we're going to use apical pulse for 3 examples on how these questions are structured. Remembering, number 1, if I show you a picture of a patient's chest and I say click on where the apical pulse is located, you will remember it's in the 5th intercostal space, mid-clavicular line, and click there. That's remembering. If we want to level it up to understanding, a question could be something like, why is the apical pulse the most reliable area to listen to heart tones or to assess a heart rate? And then your answer would be, because it's the apex of the heart at the left ventricle, it produces the loudest sound. Something like that. So that's understanding what the apical pulse is. And then if we want to apply it, we would say, you assessed your patient's radial pulse. It was irregular, weak, and thready. What would your next assessment be? So now we would choose, we would assess the apical pulse because we're applying our knowledge that the apical pulse is the most reliable place to hear a heart rate. And if our radial pulse is weak and thready and irregular, we need to listen to the apical pulse. So that's just, all those questions are about apical pulse and assessment, but each one goes up and up that Bloom's pyramid. So that's how we structure nursing school questions. Okay, next. Now this is not a study skills video. If you want me to make something like that, please let me know in the comments below and I will be happy to make that video for you. But you need to be prepared for the exam. And let's just put all studying aside, because I know you guys are studying, but you need to be well rested. You need to have a good night's sleep the night before the exam. Before you get into the exam room, you need to have used the bathroom, because having to go to the bathroom will mess with your critical thinking skills. You need to have had breakfast. I've actually read a few studies on things that can really help with test success. In order to really be prepared and do well on a test, you need to eat before the exam and include things like blueberries and walnuts. They really help your brain function. You can also use things like essential oils. Rosemary and lavender are proven to not only calm down your nervous system, the lavender, but sort of ignite your thought process or your cognitive thinking with the rosemary. So that combination has been shown to help improve test taking scores. Let's move on to our strategies. First, you need to read the question and really look at what it is asking you. A lot of times questions will be sort of a patient scenario and there'll be all this fluffy detail in it that you don't need. Look at what the final part of the question is asking and get rid of all that fluff so that you can really analyze what in the question exactly are you supposed to respond to? Look for words in the question such as first, best, priority, initial, and most important. Because if those words are in your quiz question, then it's likely a few of the answer choices are going to look correct to you. This is when you have to prioritize. What is the most important? What is your priority? And you're gonna do this by using airway, breathing, and circulation, along with ADPI, assessment, diagnosis, planning, intervention, evaluation. So you can never do anything before you assess, okay? And if there's 3 things going on with your patient, you're gonna focus on that airway first. Guys, do not read into the question. If the question is asking, what is the nurse's priority when discharging a patient who has severe arthritis of the hands? Well, just leave it at that. I see students all the time saying, well, what if they're short of breath? What if they have stairs at their house? What if they have trouble swallowing? Don't go down that road. Don't read into the question. Just look at what the question is asking and focus on that answer. Nursing exams are timed. Know how many minutes you have per question and get that kind of mindset when you're starting the exam so that you can pace yourself. You don't want to spend 5 minutes on one question because you don't know it and waste time and get behind. So if you don't know a question, flag it and move on. When you read the question and you have determined what they're asking, try to answer the question in your head before you even look at the selections below. That way you have an idea of what you're looking for before you even look at the choices. When you're looking at the answer choices, oftentimes there will be 2 obvious no's. Get those out right away. And then there will be 2 that are both somewhat correct or even correct is what you need to do at this point between those 2 answers that look somewhat right to you is prioritize. Like I said before, airway, breathing, circulation, and ADPI. Make sure that you read all of the choices before you select your answer. Oftentimes I see students see A as somewhat correct and they just automatically select it and move on. Whereas if they had looked at D, that might have been the more priority, airway, breathing, circulation, ADPI question. If the answer choices have words like always or never, you can get rid of those because really nothing is always or never. This is probably the hardest one for nursing students, but trust me, do not change your answer. Do not change your answer. When you read the question and you read the answer choices and you've thought of that question's answer in your mind, you know the answer. Something in you told you to choose A, stick with it. 9 times out of 10, when I do quiz review with my students, they missed it because they changed their answer. If you're taking your quiz on paper or if you have a software quiz program, try to utilize the highlighting device or bring a highlighter with you to class and highlight certain words. You want to look for wording tricks such as words like except or what is the least likely? What should the nurse never do? Or what said by the patient indicates they need further education? Because those questions, the answer is actually going to be what you wouldn't do. And that can really throw off nursing students because you want to select the correct answer. And in this case, the correct answer is the wrong answer. I personally don't like those types of questions. I don't write those types of questions, but you'll see them. So be aware of that wording. In this next video, if you want to click on this right here, I actually have quiz questions that we're going to break down word for word and answer for answer to help you get through your next quiz. Thanks for watching, guys, and I can't wait for you to take your next quiz, and I hope you do really well. See you in the next video.